We're breaking into programming to bring you a breaking news alert. I'm Deanna Betaneschi. Virginia Governor Ralph Northam is holding an update on the coronavirus pandemic. Let's listen in.
And thanks to all of you for joining us this afternoon. I suspect that many of you are glad that Election Day is behind us. Today I'd like to give you an update on our COVID numbers, and then we'll talk some about testing and then about the recent elections. First, let's talk about our COVID cases, which are unfortunately trending upward. Today, the Virginia Department of Health reported 1,435 new cases and 13 newly reported deaths statewide. We're seeing a rise in cases and in percent positivity, which is now 6.2% statewide, and we're also seeing a rise in our hospitalizations. This is very concerning, especially because it is getting colder. The holidays are approaching, and the temptation to gather with other people is high. So let's look at some of our numbers. You can see from this graph that our cases are rising. It tells us that this virus is still alive and well, and it is very, very contagious. Our statewide positivity rate, as you can see from this slide, is 6.2%. We continue to be concerned about Southwest Virginia, which has rising cases, community spread, and fewer hospitals than other regions of our state. The percent positivity there is around 9%, which is higher than the rest of the state. Our team has been in communication with health directors in Southwest Virginia about the spread in that region. We're focusing on a communications campaign to emphasize the importance of doing the things that we know work, avoiding indoor gatherings, washing our hands, and wearing face coverings. Remember, Virginia has a mask mandate in place when you're indoors or out in public. It's also a good idea to wear a mask whenever you're around other people, especially indoors. I know local leaders in Southwest Virginia are working with Ballard Health to reinforce this simple message. We can all protect the health workers around us when we take precautions like wearing a mask. Business, faith, and education leaders in the region sent a letter to their communities with that message last week, and it's important for everyone to hear. While we are concerned about Southwest Virginia, I want to remind Virginians that we're seeing rising cases in other regions and around our nation as well. The central region of Virginia, for example, is seeing a steady increase in case counts. So my message today is for every Virginian, because we are one state, one commonwealth, and no region is an island. We all need to step up our vigilance and our precautions, especially as we head toward the Thanksgiving holiday. It's important to remember some important points. This virus spreads through the air, and it spreads more easily indoors. You should take precautions around anyone who does not live in your own house. Yes, even if they are your family. There's no genetic immunity that prevents you from giving this virus to your mother, to your grandfather, or any other loved ones in the house with you. I'm not saying don't celebrate Thanksgiving, but if you're planning to gather with people outside of your household, think about ways to do it more safely. Consider how the space is ventilated, or think about ways to have gatherings outdoors, especially if the weather is like it is today. Wash your hands. Think about smaller gatherings and wear a mask. I want you all to be safe and to stay healthy and to do what you can to keep your friends and family healthy. As we have said all along, testing is a vital part of how we combat this virus. We have two pieces of testing news to announce today. First, we're announcing contracts with 3 labs to participate in our new One Lab network. One Lab is our coordinated COVID-19 lab testing system. It allows us to increase our testing capacity specifically to support high-priority testing campaigns, such as community testing in surge areas, outbreak investigations, and testing in congregate settings, such as our nursing homes. This network will allow us to add about 7,000 new tests per day by the end of the year. Second, we're in the process of distributing antigen tests. Those are the quick response tests. We purchased 200,000 tests through the Rockefeller Testing Compact, and those are arriving in Virginia and being distributed to our nursing homes and our long-term care facilities. In addition, we're receiving rapid Binax Now tests from the federal government and have distributed more than 52,000 of those so far. This week, we're distributing hundreds of thousands of tests to the Virginia Hospitals and Healthcare Association, institutions of higher education, and to local health departments. As we focus testing on high-need areas, our health equity team has distributed more than 850,000 masks and nearly 700,000 bottles of hand sanitizer in communities all over Virginia. As you know, our DE&I, our Diversity, Equity, and Inclusion Officer, Dr. Janice Underwood, has been overseeing this particular project, and I thank her for that. And we are also continuing planning for a coronavirus vaccine. Yesterday, we all heard good news from Pfizer that their vaccine appears to be 90% effective. That is very, very encouraging. But we should all remember that this isn't the magic bullet. Any approved vaccination will still take months to distribute. Virginia, like other states, has spent months already preparing plans for how to equitably distribute a vaccination. When a vaccine is ready, one that is safe and effective, we will be ready too in Virginia. Now I'd like to turn to the General Assembly. They adjourned their special session yesterday evening after 84 days. And I'm proud of the good work we did together to address criminal justice reform and adjust our budget for COVID considerations. But I still have some concerns, specifically about restrictions on executive authority to respond to the COVID-19 pandemic. While it is very important to work with the General Assembly, especially the money committees, and we have been doing just that, it is also important that we maintain flexibility. For example, we crafted the Rebuild Virginia project in one way, and then we saw that the needs were greater. So we were able to make changes to the program to help more businesses. In fact, in the 2 weeks since we expanded Rebuild Virginia, we've approved nearly $50 million in grants and still have some 6,000 applications to be processed. We know there is tremendous need for help for our small businesses, and we will continue to work on ways to assist them. In recent weeks, we have distributed federal CARES Act dollars to help Virginians across the Commonwealth. We have allocated $7 million to help our food banks to address food insecurity. 19% of our Virginians are food insecure. Nearly $140 million to help colleges and universities cover COVID preparation costs. $220 million to K through 12. $60 million for utility relief programs. $30 million for workforce training, and $3 million for our free health clinics. Overall, I'm proud of our work on this budget. We went into this special session to craft a budget that would help Virginians get through this pandemic, and we have done just that. This budget will help keep people in their homes with their lights on and their water running. Now I'd like to talk a bit about the elections. We saw roughly 73% of all registered voters turn out to vote, either in person, early in person, or by mail. Virginians embraced our new early voting laws. Around 2.8 million Virginians voted early in person or early by mail, a jump from 566,000 who voted early in 2016 when early voting was more restricted. I really want to thank our election officials, both at the state level and in every locality, for a smooth and well-run election, especially given the challenges of this pandemic. I also want to thank all of the poll workers, the people who volunteered their time. Elections are the ultimate exercise in democracy, and we are all grateful to those who make them work. Today, Virginia localities are certifying their election results. Next week, on the 16th, the State Board of Elections will meet to certify those results. This is our system working as it should. In the words of an editorial in the Virginia Pilot this morning, Virginia should be proud to have delivered on the promise of conducting an election with integrity, even in extraordinary conditions. End of quote. Finally, a word about the results of those elections. We expect to have a new president in January. President-elect Joe Biden and I look forward to working with him, and Vice President Kamala Harris. I am heartened that President-elect Biden's first action has been to appoint a task force to respond to the coronavirus pandemic. Other governors and I have said for months that a stronger federal response would be helpful to us, and I look forward to seeing that become a reality. In closing, I want to reiterate what I said earlier about our rising caseloads and the upcoming holidays. Virginians, you have done an exceptional job over the past 8 months of responding to this crisis. And think about that, 8 months. And I know you're tired. I'm tired. The new normal is still ahead of us. But I want to say, by and large, people have listened to the public health advice, and we can't stop now. We put on our face coverings in public, and we avoid large crowds. And we need to keep it up. It's more important now than ever. We cannot get complacent or let down our guard for the holidays. I don't want to see our case counts continue to rise, but we want to lower them, and we all must do our part. You know, we are leaders in Virginia, and I'm just like you, I'm proud to be a Virginian. We're number one in a lot of things, and I want to be number one in having the lowest numbers of COVID-19. And if we continue to work together, if we all come together and be part of the solution, we can get our numbers down where they need to be until the hope of that vaccination comes to us. So keep up the good work. I thank you for all you're doing, and I really hope all of you have a safe and peaceful holiday season. I'd like to bring up our Commissioner of Health, who's also been working overtime, Dr. Norm Oliver, to talk more about the health numbers and especially about our vaccination plans, which I think are really exciting. And then we'll be glad to take your questions. So thank you. Dr. Oliver.
As the governor mentioned, our numbers have been increasing for pretty much the last month or so, a little over a month. And that was demonstrated as well yesterday. He reported that we had 1,435 new cases of COVID-19, bringing our total case count up now to 194,912 cases. Our deaths were at 13, and total death count now stands at 3,726. Testing has been doing well. We still are averaging somewhere around 19 to 20,000 tests a day. Yesterday we posted 17,809 PCR tests. The number of antigen tests have been increasing as well. I I wanted to underscore what the governor said about the importance of continuing our mask wearing, hand washing, physical distancing as a way to keep a lid on the spread of this virus that causes COVID-19. The news from Pfizer was indeed very encouraging. We will see what happens with the vetting process at the FDA and whether or not they get their EUA. In any case, we can expect to have a vaccine from one of the many that are in play right now by the end of the year. And I want to let you all know that we are ready to get that vaccine and administer it to citizens here in the Commonwealth. A COVID-19 vaccine is especially important because in order to stop a pandemic, we really have to do our best to increase the immunity that exists in the population. And vaccines do that. They boost immunity and helps us to fight the vaccine. Although, as the governor said, it's going to take months for us to vaccinate millions in the Commonwealth. It will take a while to develop that immunity, and during that period of time, a lot of the things that we're doing now, we will continue to have to do. VDH, the Virginia Department of Health, maintains a very robust system of emergency response to things like the flu and novel viruses like the coronavirus. We've done mass vaccination campaigns every year for seasonal flu. We've done that this year. Our flu vaccination rate is up by 30%. Thank you to all of you who've been helping to participate in that. We are ready and organized and prepared to deliver the COVID-19 vaccine as well when it is delivered to us. Our unified command, the whole of government approach that we've taken to responding to the COVID-19 pandemic, established a vaccine unit early on and developed plans. We wrote a plan for how we were going to set up dispensing units for the COVID-19 vaccine and the distribution of that, submitted that plan to the CDC at the beginning of October. It was approved by the CDC. Since then, there's been, of course, a lot of new information coming out of the CDC, out of HHS around the vaccines, and as a result, we've revised and tweaked those plans, and we are ready to work with the CDC and the Department of Defense, who are the two entities that will be leading the vaccine allocation, to receive those vaccines from them and ensure that those vaccines get into the arms of us here in the Commonwealth of Virginia. One note on the safety and efficacy issue. We know and share with the rest of the people in the Commonwealth the importance of ensuring that the vaccine that we distribute and administer is safe and effective. This is our #1 priority. We work very closely with the CDC to conduct active surveillance and review of all the trials and the data coming out of those trials about the vaccines. Our vaccine unit has an advisory committee which has a number of healthcare professionals and a subcommittee that's been reviewing all the data around the vaccines and will serve as our own sort of review board to ensure that the vaccines that we receive are safe and effective vaccines to protect us from the pandemic. And with that, Governor, I will hand it back over to you.
Hi, can you talk about the decision to enter into these contracts to boost testing? Is that because we're anticipating cases to go up during the holidays, or what was the need for that? And then Dr. Oliver or anyone, if you could talk about the rise in cases we're seeing in the state, and then also maybe the positivity rate. How should Virginians mold that information? Like, what level of alert should we be in right now?
Great questions, Mel. Let me handle the first one, regarding testing. And I know you all have heard us talk about this before. Our first case in Virginia was on March the 7th. And at that time, the few tests that we had available were sent to the CDC in Atlanta, Georgia. The turnaround time was anywhere from a week to 2 weeks. And so we have worked really hard, and I think in our messaging have tried to impress upon Virginians the importance of certainly, number one, a better turnaround time, and also more testing. And so the availability of testing right now and what we've been using mainly in Virginia are the PCRs. And we've gotten the turnaround time down to 1 day, sometimes 2, sometimes 3, depending on which labs are doing it. But what's really important, Mel, and I don't think it's in response to what we're seeing or forecasting down the road with the holidays, but it's just overall the need to be able to do more testing, and also to do testing with a more rapid turnaround time. And so we've really put a lot of emphasis into the rapid antigen test, where the turnaround time may be 15, 20 minutes. Part of that process, and I might have missed it if Dr. Oliver said it, but part of that process as we move forward with the antigen test is the training of the individuals to do that. So we're also in the process of that. So whether it be for our hospitals or our healthcare facilities, whether it be for our nursing homes, our higher education schools, to be able to have more of the rapid testing will really make Virginia more nimble in order to deal with the hot spots or the outbreaks through Virginia. So that's really been our focus and our incentive moving forward. Dr. Oliver, did you want to?
Maybe I'll start. Just to add to what the governor had mentioned, the expansion of the public health capability from the ECLS lab here in Richmond and the one in Fairfax was to make sure that we had additional public health testing capacity. In Virginia, the PCR tests, which are in addition to the antigen tests that the governor just mentioned, we did almost 600,000 tests in October, over 18,000 a day. And we saw last week multiple days above 22,000. Most of that, over 90% of that testing is in where it should be. It's in the clinical areas. It's in our health systems and from doctors' offices. It's coming from pharmacies. It's from federal qualified health centers. But in addition to that, that's driven by people seeking care because they have flu-like symptoms, we also need to be prepared for outbreaks and surges. And that's why it's quite strategic to add to the public health lab in Northern Virginia, the one here in Richmond. We've added the 3 additional partners as part of one lab: Blacksburg, Southwest, Charlottesville, kind of Western Central, and then Centera Healthcare with their lab down in Tidewater. So it is all about the different varieties of labs, lab testing available to take care of the total problem. But that's really exciting because it makes sure that when there's a time of outbreak and there's a time of delayed testing times, that we have that capability for rapid turnaround in the public health to add to the total picture.
Thank you. And Mel, your second question is, I think, maybe addressing how we're mitigating or how we're planning to mitigate the higher numbers that we're seeing in Virginia.
Talk about the level of alarm that the numbers that as you're talking about cases are rising, what does the positivity rate say, and how alarmed should Virginians be about those trends?
Well, I would say, they're rising. As you see, a few weeks ago we were below 5% positivity rate. Now we're over 6. We're at 6.2. And you saw the graph just like I did. So the message is that, as I said earlier, Mel, this virus is alive and well. It is very contagious. And so we are looking at ways across Virginia to mitigate the rising numbers, and that's by increasing our testing, as we've already talked about. It's also about communication. And working with our elected officials in the regions where the hot spots are. Also working with our faith leaders is very important. So to be able to get the message out that this virus is still there, we can't get complacent. This is not the time to give up. Nobody here is giving up, and we've got to continue the push until that vaccination is available.
Yes, thank you, Governor. You mentioned Southwest Virginia and Ballad Health is continuing to set record numbers of inpatients with COVID-19 week over week. Is there any, I have two questions. The first, is there any consideration or is any capacity that the state could provide any assistance to Ballad in treating the large number of cases that they're now seeing?
Yeah, it's a great question. I may let Dr. Carey address some of it. Just before he comes to the microphone, you know, we have hospital beds. The challenge, and they may be in short supply if the numbers continue to go up, especially ICU beds, but a concern also is our staffing. And we just don't have as many nurses and technicians in the smaller hospitals. So we've got to really prepare for that and communicate with other healthcare systems across Virginia. If you We won't mention any names.
Thank you, Governor. The question really was around what assistance that we could provide, and I think the real question is, and we faced this with alternative care sites early on, and as our health system leadership let us know, it wasn't beds primarily, it was personnel. And I think the number one thing that we can do is communicate to the population, to all of us here in Virginia, especially in Southwest, how we need to take this very personally, that hand hygiene, wearing of masks, staying home if you're sick, keeping your distance, even through the holidays, especially with the holidays, is the number one thing that we can do to assist the health system today and all the men and women that are caring for the residents of Southwest Virginia and all over Virginia, is to continue this consistent message to make sure that we can control this virus. And that's how we will do it, is by making sure that we do those behaviors that are proven to limit the spread.
Thank you. The second part of my question is, Governor, might you consider imposing any additional restrictions if the numbers that we see in this area continue to rise, or in any other area continue to rise?
Well, a lot of things that we're considering, but we're right now focusing on how to mitigate the increase in numbers by the measures that we've already talked about.
Thank you.
Governor, there are folks who've called about the DMV. Those who are handicapped say they can't get their decals and signage, if you will. Wondering if you have any resolve on that. Also, people have said that maybe you should consider, if you haven't already, using some of those mobile vehicles to kind of help with that situation. And then on sidebar, are you in communication with law enforcement who may give people breaks, if you will, who have not been able to get into
Yes,
DMV?
those are all great points, and I don't think there's anybody here from transportation today, but we are aware, Andre, of the lines and the backlogs, and as you have probably seen, we've opened more DMV offices, which I think will help with that. We have worked with our law enforcement agents, and as you know, they're not writing tickets for some of the things that have been challenging for people. And I think the other point you made, to use our mobile DMV units, is something that we'll continue to do. And if we can ramp that up, I suspect that would be helpful as well. But we are aware of the challenges and trying to accommodate everybody's needs as we move forward.
A couple times we've talked about correctional facilities and
Yes.
inmates who say they need more PPE and
Yes.
issues around safety there. Got a couple calls wondering if you would have maybe Secretary Moran and maybe you visit some of these facilities, maybe outside in a safe way, to hear directly from the inmates who feel as though they're not being heard. You may be getting mixed messages from inmates versus staff, if you will.
Mm-hmm. Well, I do visit the correction facilities. Brian, did you want to comment any on that? I mean, we communicate with the chair of our Department of Corrections, and certainly Brian more than me, but those communications are all ongoing. If you want to kind of give a little update on what we're seeing at the corrections units, and that's great. Thanks, Brian. Never want to put you on the spot.
Very well. Happy to do it, Governor. Thank you. Andre, thanks for the question with respect to our Department of Corrections facilities. As you know, this has been a deep concern of ours throughout when the first case arose on March 7th. I will say Some good news. Some of the numbers continue, though. We have 240 offenders who have active COVID cases. 239 of those offenders at the facilities. One is in the hospital. But 3,812 offenders have recovered. 33 offenders have died. But the good news is that we haven't had anyone since October 2nd. And so, it's well over a month now. We've performed tests. 47,804 tests have been performed. You heard the governor talk about how our testing has increased, and certainly at our correctional facilities, we have maintained a robust testing system. So, in addition to that, the PPE continues to get distributed, both from DOC themselves, who actually manufactures masks and other PPE equipment, and certainly that we provide them any and all that is requested. So challenging times, but I think DOC, the leadership of Harold Clark and others have really stepped up. We'll say with respect to the visits, I think really, in addition to all the other challenges we've had, that is something I really miss. The governor has joined us on many occasions. In fact, there's a Veterans Day luncheon that we typically enjoy this time of year and attend, and at Deerfield Correctional Facilities, and it really is one of the highlights of the year to see and enjoy lunch with them. And so we'll resume those visitations as soon as it is safe. We certainly do not want to impose on our facilities and do anything that would actually create a problem with respect to the spread. But as soon as we have vaccine, I look forward, and I know the governor does as well, in resuming our frequent visitations to these facilities.
Thanks, Brian. Appreciate it.
Bill Atkinson, Progress Index.
Thank you. Governor, following up on David's question about the restrictions, would your administration be looking at how the numbers come out through the holidays to determine if Virginia will go into another lock? And if so, how long do you think it would take the Virginia localities to get out from this one?
I'm sorry, I heard some of what you said and missed other parts.
Okay, I'll repeat it. Following up on what David McGee from the Bristol asked about restrictions, will your administration be looking at how the numbers come out through the holidays, primarily through Thanksgiving and maybe even Christmas, to determine if Virginia will go into another lockdown?
I appreciate the question. I heard you that time. Again, we're looking at ways to mitigate these rising numbers. We look at the numbers every day. We're not just looking at the holidays or whatever. So every day and following the trends. And again, I think one of the I guess responses that we have is to understand why the numbers are rising. And that's why I have reiterated what we know works, but certainly I can tell you this virus is, it spreads through the air, it is very contagious, and if someone has the virus and doesn't have a mask on and you're in their presence, there's a real good chance that you're going to contract it. So behavior is very important. We know that getting into groups, especially larger groups, and that's why with the holidays coming, we just really implore people to keep their gatherings to a minimum, to keep distancing, all the things that we've been talking about, wearing masks, et cetera. If we do these things, then we know that we can keep the numbers under control.
Not to beat a dead horse when it comes to guidance and restrictions with COVID, but when I look at the state metrics, I see that we're seeing, daily new cases rise higher than they ever have in the pandemic. And so I'm wondering, what it would take, what metric you would look at that would trigger a new, possible new restrictions. And then, you mentioned that what's making COVID rise. So, can you speak more specifically to why 8 months in we're continuing to see these spikes and lulls in Virginia?
Yeah, a couple of things I would say, Kate, and I appreciate your question. We are seeing higher numbers of new cases, but I would reiterate that we're doing more testing. Early on, we were just doing a few tests every day, if that, and now we're doing 20,000 plus tests, and we'll continue to do more. So we'll follow the number of new cases. As you saw, that curve was increasing. But I think as important is following the positivity rate and also the incidence rate. But just speaking to the positivity rate, if you go back and look at the graphs, I mean, we were over 20% at one time in Virginia. Now we're at 6.2. So yes, there are more cases in Virginia because of more testing. The positivity rate, while it's increasing, is still relatively low. And so we monitor all of these things. And again, I would just, again, not to beat a dead horse, to use your words, but we need to continue to be able to figure out why those numbers are rising. And they're rising right now because people are gathering and they're not wearing masks. And if you look at where they're not wearing masks, you see the increased numbers. So it's, I won't call it scientific, but it's pretty straightforward. And so we've got to look at, when we talk about mitigation, really how do we change people's behavior? That's really the challenge. How do we encourage someone to just get up in the morning when they go outside the house to put a mask on? That, in my mind, is not asking a whole lot, but it certainly is for some people. And that's why I mentioned earlier, it starts with leadership, and I'm going to do everything that I can to continue to put that message out. But it's good to see that we're going to get that message coming out of Washington as well, and I think that's going to be very important as we move forward.
Appreciate the fact that you're going to do a marketing campaign in Southwest. However, we have heard this message all along and have been putting the same message out about wearing a mask, staying distant, and the behavior hasn't changed. And so is it time to do something a little bit stronger, such as enforcing the mask mandate with fines? And also, we have situations now with outbreaks in public schools and sports about to start. So, are you going to recommend that schools not participate in winter sports?
Two questions there, and they're both good questions. The first is about enforcement, and we're certainly looking at businesses and making sure that they comply. And we also now have the availability of a civil penalty. As you know, it used to be a criminal charge, and so that will, I think, allow us more options for enforcement. I've said all along, this is not about carrying a stick around, this is about carrots, and I would really encourage Virginians to continue to follow the guidelines, and again, not just for themselves, but as Dr. Carey said, for the people that are working in our hospitals, the frontline workers in our grocery stores. We need to think about all these people, not just ourselves. Regarding sports and obviously schools, we continue to provide all of the information that we can. We have the dashboards for the localities, but I can promise you that Virginia is very diverse and one size doesn't fit all, and that's why we've given the localities the discretion to make decisions on returning to school, and that's the path that we'll continue to follow in that regard. One more question here. Jamie?
Jackie. So close. But
I had the J right.
That's fair.
Okay.
But anyway, so you mentioned, your excitement about President-elect Biden, presumably going into office, and you have repeatedly obviously criticized the Trump administration. So I'm wondering what specifically you think that the Biden administration can do differently to help Virginia that the Trump administration has not done?
Yeah, it's a great question. There are a lot of things, and it starts with messaging and encouraging people to follow these guidelines. It also includes options, and obviously we're going to be communicating governors with the national leadership, but it's using things like the Defense Act to if we need more supplies, if we need more swabs, if we need more reagents, if we need more Binax testing, all of those things will be important. But I think a lot of it is, again, I'm repeating myself now, but it's really looking at behavior. And this shouldn't be a Republican versus a Democrat or metropolitan versus rural. It's really all of us. And in our case in Virginia, we're all Virginians. And let's do the right thing, not only for ourselves, not only for our families, but for those around us. So that we'll continue the communications. We've already been in communication with the task force members, and we'll continue to do that moving forward. I thank you all again for tuning in today. And my message as we leave is that nobody's giving up here. We can't give up. And I'm a runner. I'm sure you all have been in, situations where you see the finish line and you just say, I don't know if I'm going to be able to get there. I'm going to stop running, start walking. This is not the time to do that. This is a time to really dig in, to be vigilant, to be hopeful that there is light at the end of the tunnel, that there is a vaccination. And by the way, putting on my doctor hat, and I think Dr. Carey and Dr. Oliver have already discussed this, but we have all been involved in clinical trials, and when there is an effective rate of over 90%, that is really very, very promising. And so I would encourage all of you that we're going to get there. We're going to get there together, and we're going to get there by continuing to follow the guidelines. And, we want to get our businesses back open. We want to get our children back in school, but we need to do it safely and responsibly. And we all want that new normal. So thank you all. Be safe. I probably won't talk to you before Thanksgiving, but certainly have a safe and peaceful holiday season, and spend as much time with your friends and family, but do it safely. So thank you all.
All right, you've been watching a news conference from Governor Ralph Northam about the coronavirus pandemic. He did say that cases are trending up. There's 1,435 new cases. There are 13 new deaths statewide. There's also a rise in positivity at 6.2% and also a rise in hospitalizations. He also mentioned a concern about Southwest Virginia. He says that the positivity rate there is around 9%. He said that they're working on a campaign to try and remind people to stay safe in that area, to continue to wash their hands and wear masks. He also has a message for every Virginian. He says it's time to step up precautions. He says this is especially important as we approach Thanksgiving. He said that it's not a point where he's saying don't celebrate, but he said if you're going to be meeting people who are outside of the people who you live with in your household, to maybe thinking about moving your celebration outdoors and reminding everyone to wash their hands a lot and wear masks when you can. He also talked about testing and distributing antigen tests. He said there are 200,000 that they're working to distribute. Of course, those would go to nursing homes in high-need areas first. He also talked about planning for the COVID-19 vaccine. He talked about the vaccine news that we had yesterday, saying it was encouraging. And he said that they'll administer it to Virginians when it's safe, and they do have a distribution plan. He also talked about the elections. He said there are 2.8 million Virginians who voted early in person or early by mail, and he thanked the election officials for the challenges that they also faced, especially during the coronavirus pandemic. He also talked about mitigating cases and said at this point there are not going to be any closures or restrictions, but they are going to continue to monitor the number of cases that are coming in. And remember, we'll have all of the latest details for you tonight on Wavy News 10 at 4. This has been a Wavy News 10 special report. Now back to your regular programming.